अब मैं आमंत्रित कर रहा हूं प्रोफेसर विनय कुमार पाठक, जो कि अध्यक्ष हैं एसोसिएशन ऑफ इंडियन यूनिवर्सिटीज़ के और वाइस चांसलर हैं CSJM यूनिवर्सिटी कानपुर के कृपया आएँ। और साथ ही साथ आमंत्रित कर रहा हूं डॉक्टर विकास महात्मे, ऑप्थेल्मोलॉजिस्ट, सोशल एंटरप्रेन्योर, और जिनको कि पद्मश्री सम्मान भारत सरकार द्वारा दिया गया है कि चेयरपर्सन के रूप में मंच पे अपना स्थान ग्रहण करें। और हाँ जी, और अमोद सर से, जो कि इस सेशन के कोऑर्डिनेटर हैं, उनसे अनुरोध है कि सर को टॉक के लिए इनवाइट करें।
Professor Vinay Pathak doesn't require any introduction. He's an academician of excellence, and now we are going to get some enlightenment about the wellness. Professor Vinay Pathak.
So namaskar and thank you very much for inviting me. Dr. Sachan is already a very visionary person, so he is having this conference which is confluence of all the things, all the pathies. I think which is a very good initiative in the direction of the wellness conference. I also want to congratulate Praveen and his team and Dr. Sachan and his team for holding this conference here. My presentation is especially for the new doctors, especially for the medical practitioners who are coming in the next generation. AI in medicine is an important topic. It's not only important, but important that as India produces maximum data in the clinical technologies, why not to have our own tools in AI? So let us look what AI can do. So I think all of us knows about artificial intelligence, and in the field of medicine, it is becoming more and more important. There are two words which we have to look into those things. One is deep learning, by which people learn, and whatever tools you have, if you train those models, it will learn and tell you back. But there are other techniques which are coming, and the latest features are doing in deep imaging, where suppose you have got an X-ray film for a smaller thing, and then you have to perform the test of PET, CT, and all those things. So with that small X-ray machines, X-ray data, if you have got the larger data of all other X-rays, suppose you have got one X-ray, one CT, one MRI, one PET CT of the same person, and such thousands and lakhs of data, then with a small X-ray, you can train the model and you can get what can be the predictions of those CTs and MRI and PET, which is an important technique, because a lot of people don't afford, like us in the country, to do those things. So why medicines needs AI? So there are a lot of things, and I think there are non-invasive techniques. There are techniques of AI tools. There are techniques of smart watches. There are techniques of smart health. So their challenges is overloaded healthcare system, rising cost and demand for precision care, and human error and bias. So if there are three things, then three solutions are there, which is automatic data interpretation, predicting disease early, enhancing accuracy and efficiency. There are a lot of health systems today in the world, like Sweden is one of them, where when the patients tell the doctors the symptom, it is not only recorded by the medical practitioner, but also recorded by a machine. And then machine also go and dig in their own databases. And when the symptom taking is over, then the machine also gives you assistance that what kind of disease it may be. So there are a lot of new tools which are coming. Recently, the chief of AI at Google has predicted that due to the fast competition and due to the new techniques, there can be solutions to lot many diseases which was not possible earlier, like Parkinson's, like new gene computations, like new computational powers for AI. So we have got data, we have got machines, so you can predict a lot of targeted medicines, lot of machines, lot of diseases which was not having a solution for 100 years can now be done in 5 years. That is what they have predicted. So this is what it profound implications. So AI is also very popular in the drug discovery. So it is speeding up research in drugs, identifying drug targets. Machine learning models help predict disease mechanism, allowing research. So if you want to compute and it needs a lot of computations which is not possible, that can be done. And virtual screening, AI-powered virtual screening technology can simulate and evaluate the interaction between drug and targets. So which was done physically can be also done by virtual and the simulations. If you look to the personalized medicine, I think that's one of the important things which in this era, although Dr. Vanna has spoken about Ayurveda, so Ayurveda was famous and is famous for the personalized kind of a medicine. Even two people having similar symptom may require different medicines at point. But now I think the modern medicines are also requiring all those things. So AI analyzes patient data to recommend personalized treatment plan, taking into the account of individual genetics, which is there. And the gene editing and the genetics knowledge will be 100 and 1,000 times increased with the AI kind of interpretation. And so we can have a personalized medicine, the predicting treatment outcomes and monitor patient response, that we can look into those things. This is one of the important things which I have always told, and I think the diagnostics or image recognition has actually was the game changer in the earlier centuries for the medical practitioners. But now with this image and with the AI at the database, we have got thousands of databases. We published also a paper in Corona times with KGMU Medical College and a lot of other colleges, where when we have seen the X-rays, we can predict that whether it will be COVID lungs or not. So with the new competition, with the new image recognition, we can do fast kind of a thing. NLP is one, natural language processing, so it can unstructured data from medical report. So if you compute and have the medical record, it can do. And the predictive analysis, AI tool can predict diseases, outbreaks, and identify at-risk populations. So clinical trials or optimization is new things which can be done, which is patient recruitment, data management system, and the trial designs, where the machine learning helps in designing more efficient and adaptive trial. So these three things also can be supported by new AI techniques. So there are regulatory considerations in AI applications. So AI is double-edged sword, and there are a lot of discussions going on AI, whether AI can be used or not. So the AI has got such ethical implications, which is important. We have to deliberate. Continuous marketing is important, and compliances with the guidelines, whatever the guidelines we have on the ethicals, because we are actually dealing with the living organisms and the human body. So these are the future trends in the healthcare and AI. One is integration of genomics. So this genomic data is an important thing, and I think a lot of new kind of Nobel Prizes are also getting into the immunity kind of a thing. So genomic data and understanding genomes and understanding gene things is important for medical clinicians for a long time, which can be now solved with this AI. Remote patient monitoring, even AI has got a wearable technologies, so you can monitor from your house, so doctor can monitor from a remote things. And AI-driven drug repurposing, so leveraging existing drugs for new therapeutic purposes. So we compute, and those can be new things. So challenges and limitation in AI healthcare. data quality and availability that has to be looked upon for how and what data we are getting. Interoperability issues are there, whether AI can be just joined with the healthcare system, and there is a need for more trained professionals to implement AI in the healthcare. This is case studies. So IBM Watson is one of the software which has said, so analyze patient data to recommend personalized treatment options in oncology. So IBM Watson has done. Google DeepMind identifies eye diseases from retinal scans with high accuracy. BioNTech and Moderna utilize AI in rapidly developing COVID-19 mRNA vaccines. So these are the case studies which has helped us for a longer time. So I have already told that this is our AI in medicine, drug discovery, personalized treatment, and improved diagnostics. These can be 3 parts. So the core technologies which are behind of AI in medicine is machine learning, predict patient outcome and identifying disease patterns, deep learning, image and signal analysis using neural networks, NLP, understanding and summarizing medical text in patient records, computer vision, detecting anomalies in medical imaging, reinforcement learning, optimizing treatment plan through feedback. So these are the core technologies on the left and role in medicines are on the right. So we have said that these are the computational tools which we have said, and these are machine learning detecting diabetes or heart disease using EHR data, predicting sepsis risking ICU patient, AI models help triage patient during emergencies. So these are the algorithms which are used for that. Deep learning, I have explained you earlier, deep learning and deep imaging. These are detecting tumors in CT, MRI and X-ray scans to the point, classifying skin lesions and retinal disorders, enhancing image quality and segmentation. These are the examples. Google DeepMind's AI detects 50 types of eye diseases with expert level of accuracy. So NLP, which I've said, summarizing medical records, detecting adverse drug reaction from text report, chatbots for patient communications. So chatbot can be a new area which Dr. Sachan can also use here for those kind of things. So my final thoughts is these things. I will request Dr. Sachan, because he's very, very revolutionary person, to have a center of AI and medical here in the Hind College, where a lot of medical doctors can also use these things, and we can actually have new tools. So these are the thoughts that India is having data. Indian doctors are good in treatments, but Indian doctors are very poor in recording their researches. So AI can give us one kind of thing where we should keep our data properly. Otherwise, we will have to buy these AI tools from West, where they have got very less number of patient data. And they don't have so much data, but they are very good in recordings. I think this is the time when medical people, engineering people, and other people should join hands, make indigenous medical devices, make indigenous AI tools, and make low-cost diagnostics, low-cost health services for all. Because this is an era, and this is an era where technologies and people are going into one. So we say always this is, we are going into Industrial Revolution 4.0 or 5.0, where man and machine is going to be one. And this is what AI has got a promise. So friends, this is important for all of us, that we should go and try to do these kind of AI researches. And the other day I was in the convocation, and then also I requested all our young professors and doctors, because in our systems of education, if a people is studying medicine, he will not understand engineering or not go to the. If he is a biotechnologist, he will not go into that area. So this world is now flat, and this world needs a lot of collaboration. Thank you very much.
Thank Thank you, Professor Pathak. You have very, in detail, you have described the application of AI in the research and drug development. And in day-to-day practice, in fact, the AI has got tremendous scope. Even during the OPD clinics, now AI tool has been developed where the conversation done between the patient and the doctor is recorded, and he writes the prescription by itself within few seconds time. And secondly, in IPD also, we can use this AI where it gives the prompts even for the provisional diagnosis, recommendation of the treatment, and also it can recommend the investigations, what all investigations are required. But ultimately, the human brain cannot be replaced by any AI. So ultimately, at the bottom line, we have to really analyze everything, whatever the information has been given by the AI, that is correct or not. Secondly, as Dr. Pathak has enumerated, that with this invent of AI and its application in India, this is going to make a remarkable change in the research. Because as he has pointed out that we are very poor in keeping our data. But incidentally, because we will be working by these tools in day-to-day practice, we'll have enough data. And the data may be so much that we can compete with the most advanced and developed world. Thank you, Pathak. It is really excellent. It is a really excellent presentation, and it has really enlightened us. Any question? If someone wants to ask anything, otherwise we should go ahead.
प्रोफेसर अमोद और डॉक्टर विकास महात्मा जी से अनुरोध है कि हमारे आज के दोनों स्पीकर को फेलिसिटेट करें। सब लोग आ जाएं।
Announcement regarding the two awards which the committee has decided. One is International Award of Excellence in the field of education, which goes to Professor VInay Pathak. And second is the Wellness Excellence Award in Ayurvedic Medicine, that goes to Dr. Mrs. Vandana Pathak.